Hi, this is Dr. Grande. I hope you find this video useful. If that's the case, please like it and subscribe to my channel. And as always, thanks for watching. And you talked about that before, and I think that's a good insight, that the emotionality, right, the anxiety and the worry and the nervousness, they're enemies of clear thinking.
Yeah, for sure.
And logical thinking.
Yeah.
And sometimes it's only afterward we can really stop and say, let me really work this out.
Right.
Let me do the math, so to speak. And you'll see that you might have overestimated the risk.
Yeah, I think that when you were saying writing it down and stuff, like right after it happens, I think that would kind of, like to write like a pro and con, for lack of a better term, list, or like this, which is, and then see which is more likely if I'm having trouble like teasing it out. I think what you suggested would be helpful.
All right. And I'd like that to be the homework after this session. Or I should say most CBT has homework involved.
Okay.
And it's not necessarily like homework that you might have had in school, but rather these are really practical steps that I feel have a really good impact in clients' lives.
Okay.
Right. So I know that the tendency sometimes is to think, oh, homework. You know, well, there's an automatic thought associated with it, right?
Right.
Which should be, this is a waste of time, or
right.
I can still benefit from the therapy without it. And of course, you could. But I would say, you want to get the most out of this experience. I would say try to engage to the degree you can in the homework activity. Like the practice you were talking about. Yeah, and we'll get into kind of more involved homework as we kind of move through the cognitive model and deeper into the therapy. But for now, what I'd like you to do is when you have that feeling of anxiety, worry, dread, sadness, anger, right, the different emotions we've talked about, just try to write down what was going through your mind before that emotion was noticed. Okay. Right. If you want to create self-talk to address those thoughts, that's great. Okay. Right? But for this week, all I really want to focus on is just capturing those thoughts. Anything you do above that is wonderful, and I encourage it. Okay, so like my emotion and then the heat of the moment thought, like right before it. Yeah. And of course, if you want to take it to the adaptive response, that's great. I would encourage that. But just in terms of taking the steps, what I really need is just getting that thought written down. Okay. And I realize that can be a little inconvenient, and it's a skill you have to kind of get used to. Okay. But I would say if you could capture, like in this week, maybe 5 thoughts, I think that would be plenty to work with next session. Okay. And give us a lot of opportunity to really explore the beliefs, the situation, and then to create those adaptive responses. And what did you say that was called again? I think you said like a thought log or something like that. Yeah, there's an actual there's an actual record, a form that we'll get into that has some other elements too. But this I could do in like a notebook. Yeah. Okay. Yeah. Excellent. I think a notebook would be perfect. And then as we get a little farther down the road, we can get into the thought record. I'll show you where that piece goes into the thought record. There's a lot in the thought record to handle in one session. We'll take that kind of over a few sessions. Okay. But once you kind of get toward the end of this therapy, you'll have that and some other tools, and you'll be comfortable using that. And this would be a good first step. Okay, great. I'd like to wrap up by asking a few things. One is asking if you have any questions for me. I don't think so. You feel pretty comfortable? Yeah, I think it definitely, although my anxiety was higher when we were kind of talking about it, I think it was comforting to kind of work through steps that I could take for myself to kind of calm myself down in the moment. Great. Well, and that kind of brings me to what I want to say here to wrap up, which is, I've listened to what you were talking about with the car being stolen and the person coming to your house before that. and your anxiety and worry. And all this seems, of course, very scary, but also a very natural reaction.
Okay.
Right? I think your reaction is certainly understandable by almost anyone. I doubt there'd be really anyone that wouldn't be a little disturbed by having their car stolen and their house burglarized. And I think anxiety is, again, a normal response to that. Now, it's kind of expanded into other areas, and that's sounds like one of the reasons you came in.
Yes.
Which was the right move, right? So I want to encourage you for that, for coming in and for kind of recognizing, things aren't quite right. I'm a little too anxious for kind of healthy functioning.
Right.
I need to get in front of this problem. That shows a great deal of conscientiousness and awareness, and you really have a kind of a self-care component of your personality that got activated, and you listened to it.
I never thought about it that way.
Yeah, you listened to it. You do what you had to do to keep yourself healthy for your own sake, for the sake of your family, and the sake of your job. So that's really quite responsible and shows a lot of resolve, and I think probably tends to predict a much better outcome. So I want you to feel encouraged by that.
Thank you.
Yeah. Also, with your ability to connect with the cognitive model, like in terms of picking up on the automatic thoughts and the feelings, and then working on those responses, you're obviously quite bright, articulate, you're able to connect to that. I also think that tends to predict a better outcome for you.
Okay.
So I just want to recognize that and encourage you to keep bringing that kind of thoughtfulness and intelligence to what we're doing here.
Thank you.
Mm-hmm. So you understand the homework going forward?
Yes.
And we'll make an appointment. I'll see you, if it's okay, about a week.
Okay.
And we'll pick up right here. We'll work on those thoughts, and we'll keep moving through the model, and we'll try to move toward getting rid of this anxiety and getting you back on track.
Thank you.
All right. Thanks, April.